Alrighty, so hi everyone tuning in. My name is Maria. I'm a third-year medical student and the chair of FSEP MSc. I'm joined today by Dr. Robin Hawley, the PD over at UCF North Florida. So, Dr. Hawley, if you'd like to introduce yourself.
Sure. I'm Robin Hawley. I'm the PD at North Florida and have been since the inception of our program, which is 6 years ago, 8 years ago now, actually, 8. And our program is the University of Central Florida in Gainesville, which is North Florida Regional Hospital. Yeah.
Very nice. So, I guess some icebreakers to get started. Right now, what song are you listening to over and over again? Or what song could you listen to over and over again?
Okay. Okay. We talked about this before because it has to be G-rated because this is recorded forever. And when I run for president, it's going to come back to haunt me. But I will tell you that I actually really like Hey Homie by Sophie Tucker as well. And right now, that's like my new jam that I'm listening to over and over again. But it's fun and it's kind of silly. So it's catchy.
Yeah, I love that. I'm a big music person, so those are my big things. I'm either like a 70s girl or like a Latin pop. All right.
Run the gamut.
Yeah. All right. So then another one, how would you or what would you name or describe your residency program based off of your initials?
Okay, initials RH. Um, Resuscitation hard ass.
Okay, I like that. I really like that. So then I guess going off of that, introduce your program. Like just give us a little gist of what
Sure.
it's about and what you like people to know about it.
Sure. So we are a community hospital. Our patient population is rural northern Florida, as well as Gainesville City, which is considered suburban. So we have about 105,000 visits a year now. We have a main hospital. We also have opportunities in our freestanding. We are very community based. We are unopposed in our department. Our residency is unopposed, and the group of faculty that are here, we are basically a group of faculty, GEMA, and we've been there since way before the residency, and we're all partners and we run our group. So that has been really important to really have a cohesive mindset in the department for the residents. And it allows us to make staffing decisions, for example, based on educational opportunities, which is really nice because you have to have a similar set, like a similar outlook and a similar set of goals between the, program director and the medical director. So
Okay, nice. Love to hear that. And so I guess going off of that, what does a successful resident look like at your program?
um I love that question. So there's a whole list of milestones that ACGME has released on what a successful resident for graduation looks like. And of course, you need to have that. I think that over and beyond that, a successful resident at our department is totally in it to win it for the team. And I don't mean sacrificing yourself for the team necessarily, but this phase that you're going to be entering in your life, it's awesome. There really should not be a bell curve. You don't have to beat out someone next to you to get that spot, to get that OR time, or whatever it is. And it takes maturity to switch from a student mindset where that has been drilled into you forever, into an adult team aspect. And you have to do that. And the residents that are mature enough and have that outlook, the program is not only amazing because of faculty and everything we've put into curriculum, our research, like all that stuff. It's because the residents are together and the residents are lending each other their skills, because not everyone's good at each individual thing. And I think that's really important. So a successful resident is that resident who comes to work and is part of the team of not only the attending, the resident, the nurses, everything. And we look for those residents that really, or the medical students who have demonstrated that already, that they're there to be a part of the team and to make the patient's experience better.
Yeah. Great. Yeah, that's really nice to hear. It's like a very collaborative environment. Sounds welcoming and all of that stuff. So I guess going off of that, how would you say your curriculum balances those clinical experiences with didactic training or didactic education?
I think that's a great question. Didactics are completely protected. So there's no one working didactics. You don't carry a beeper. You're not on call. Like if you're in the MICU rotating, you have didactic time off in our program and you're not on call for any of your patients, for example. Patients that are on our trauma rotation have the whole day off and they are in didactics. That's always protected. So some of that balance comes from really protecting that didactic time. And didactics is not just where, you get information shoved at you. It really is where you connect with your fellow residents. You check in. We see each other. COVID was terrible, and getting back to didactics was like our number one priority for really wellness and community. And I think that's why we hold it in such, it's the holy time, like you get to go. I think that also it's important to say that we do have one resident that's overnight the night before didactics, but then everyone else goes home before midnight so that we don't have a mid shift that ends up being dead on their feet in didactics sleeping, which I feel like I may have done during my residency multiple times. So that's kind of how we balance the two, because we really make it accessible.
Yeah, no, I know that like post COVID, it's been so nice to see all these programs and schools and everything get back to being in person and actually like being like co-residents together is so important.
Mhm.
Like, just
And
having community.
we do a lot of gamification, so it's really hard to do that on Zoom, and it really brings everyone together slightly. When I said there was no bell curve, it's true, there's no bell curve, but that does not mean that you can have two teams at it. And like even today we did the what's the lawn game where you throw the beanbag into the hole?
Oh, cornhole.
Yeah, so we had cornhole. So you had to answer the question, and if you answered it correctly, you had an opportunity to double your points
Oh.
by getting the beanbag through the hole. And so we had like a little bit of a competition there, and people really like that. It keeps you awake. You have to get up and throw the beanbag. It, keeps
All
you going.
friendly competition. It's friendly competition.
Yes, nobody was hurt during the competition. Everybody made it.
So then going off of that as well, what are, I guess, some key highlights for the clinical training that you guys have, especially when you're first starting out residency? I know like in different specialties, it's kind of different how you progress through residency.
Sure. So in EM, you are, as an intern, everyone is in the department in July. So almost every single resident, second year, third year, are in the department. So it really is like your family, your mentee family is in the department. And as an intern, you come in, you transition, and you're kind of trying to figure out where the bathroom is, what your sign-on is, and you've got your senior right there. We're like overstaffed for that time period. So you have someone to help you directly through all those transitions. And in July, the clock restarts, our interns have first dibs on procedures. So our seniors and second years, they've all had over 50 intubations by the time they get into second year. They're there to help the interns do it. And so I think that something that's really great in our program is that one, they're unopposed, but supported in that first month. And then they get access to all the procedures. They don't have to fight for that. We don't have ortho. We don't have surgery in our department. You do all your own reductions, all your own fracture reductions, all your own tubes, chest tubes, LPs, all of it. And then we also have a really great experience as far as a mentee family that helps reinforce the aspects of your training early on to help you feel like you have support if you need it, hey, do you have anything that, you're concerned about in the program or whatever? Or, hey, did you remember you have to fill out your procedure log? Kind of helping keep tabs on that big brother, big sister, little sister, whatever it is, kind of scenario. So I think that's really helpful in that, clinical training, even though it's like a mental support, it's also in the department. So I think that's important. The interns also from day one go out to the freestandings, and the freestanding EDs is a unique environment to learn in, because every single patient you see is undifferentiated. So you don't have the layer of a triage nurse or the layer of somebody MSing, depending on what your what your emergency department is like, where you train or where you've rotated, and you're seeing them undifferentiated. And while the majority of cases that go to a freestanding are fairly low acuity, you will often have very high acuity patients with limited resources. And as an intern, you're working one-on-one with an attending there too. And so you get that one-on-one feedback, that one-on-one guidance. You really get to know your teammates when you're working one-on-one with someone. And so I think that early exposure to that environment is at least our residents really enjoy it and say that's an important part of their training.
Yeah, it's like you learn the more you do, the quicker you do it, and like the earlier exposure you get, for sure. So then, how much elective time is built into your program? Like, how do residents get to explore subspecialties in EM and stuff like that?
Sure. So our PGY 3 year, you have 1 month elective time and you have 1 month selective. And the selective time is teaching ultrasound, EMS, or administrative. And you can do any one of those four. However, we have 8 residents a year, and part of our dedication to our residents are that you're allowed to be interested in and develop a niche or an area of expertise. So we are able to really work with residents to give them experiences that will help them. We have someone very interested in rural medicine. We've created a rotation where they go out to a freestanding that we don't normally rotate students out to, but it's in a rural community that is more of a critical access hospital for them. And so we're able to build that in longitudinally. We have someone who was previously in the Air Force and then was a police officer and then went to medical school, and his specialty was tactical medicine. We were able to build an advanced tactical medicine EMS rotation and get him unique experiences that are different. Not everybody wants to do that. We also have global health interests, and we've had residents match into clinical informatics, administrative, critical care fellowships, ultrasound fellowships, and we also have 3 tracks available. Not like you don't have to do a track, but if you're interested, you can do an advanced ultrasound, advanced EMS, or advanced EM admin track. And those tracks provide specific, unique experiences throughout the whole year to help get you extra experience and give you that expertise that you might be interested in.
Okay, nice. That's so it sounds like you guys kind of cater to what your residents want, which
Yes,
is
it's individualized, kind of specific. You don't have just one cookie cutter, because everyone has their own interests and level of knowledge already. So we try to build that out to demonstrate that having an interest or niche is really important for longevity. And so we want to support that.
yeah, great. And then so going off that, are any of your residents that graduated from your program attendings now, or where do they go off after
Yes.
time with you?
So we've retained a lot. We opened another freestanding, so we were able to bring on people. And so over the years, we have currently 8 of our 24 attendings that work in our group. 8 of them are past grads. We're hiring 2 graduates this year that are graduating this year, and we have 2 grads that graduated in the years past who are returning because they want to come back and work with us instead of their own situation. And we've had some people retire out of our group. So we've been able to make room for them. And so, yes, we actually have a lot of our grads working with us now.
Nice. So it's like a continued long-term
Yes.
family.
Oh, yes, actually, they're all we have lots of residency grandkids now and
Oh,
residency kids. And yes,
nice.
forever family.
So then what do you guys do to promote wellness at your program?
That's a great question. We are very focused on giving our residents or creating an environment for our residents to thrive in. So some residents are really focused on like wellness day. Like, okay, there's 2 wellness days a year. Every program, it's fairly common. Every program has them. We protect the residents' time for 24 hours around that time. So they don't just have like the morning off, and they get to choose what they want to do. And the attendings participate. We've done things like paddleboarding down the river. We've done things like paintball. We've done top golf. We've done um, what's it called? We took boats out under the Gulf. Like we've done all different things, whatever you
Yeah.
want. That's great. Those are wellness days, but that's not really the crux, right? You have 363 other days of the year. And so we pay attention to a couple of key things that I think are really important. One, we pay attention to community. So we make sure that the residents have the opportunity to connect with each other. And that's, again, we hold didactics as like kind of like the holy grail. We have very strong mentee mentor families, and 2 mentee families are teamed up in our large like gamification system, kind of like the Hogwarts houses. So we have a larger an extended family and a smaller family, and we do activities 4 times a year with our mentees to make sure that connection is there. We make sure that on EM rotations, each resident has a golden weekend. That means the Saturday, Sunday off contiguous. We have vacations are a whole week, and 99% of the time they have both weekends on both ends. We know that's really important to people. We also take votes and adjust scheduling every year depending on the current vote. Like one year was a big push to only have 12-hour shifts on the weekends because that means you're in the hospital less weekends. Then the next year, they were like, we don't like that. We want 8 hours. You're in the hospital more days, but you have more days on either end. And so we listen and we have the capability of being flexible. So I think that is part of the wellness that's really important. So the scheduling issue, I and the mentees and mentors really, the mentees know that the mentors are available. And we really try to create that family connection so that everyone has somewhere to fall back on. And we do a couple of other things. For example, I do an opt out with our EAP program, and that's where a resident can at any time get free counseling, totally unknown to me or UCF or the hospital. No one knows. It's their own private like business. But what we do here is I call and I arrange for the EAP to call each and every resident to find out if they want to schedule a meeting instead of the resident having to find the phone number, call them, and do all of that. And so we do some proactive trying to just remove barriers to make it as easy as possible for everyone to be in the best situation they can be and to thrive.
Nice. It sounds like obviously you guys really care about your residents, and I'm gonna link the website, your program's website in the YouTube link. But there were some cute pictures of you guys at like the wellness events and stuff, so I'm gonna link them so people can go watch. All right, and then I guess another question as VSLO is starting up and people are applying and clinician nexus to your program, like how can applicants stand out? What do you look for in applicants, whether it's for residency or whether it's for medical students that are coming by?
So any inkling that I have that you're interested in learning is going to stand out to me. It's We were just talking about this before we got on, that different schools have such a different process of allowing electives and assigning EM rotations. So some people may be rotating with us who have never, it's their first EM rotation. Well, those people deserve a little bit more investment and a little bit more to get them going versus someone who this is their third rotation. And so you can't really decide on a student because of that. You have to look at their application and see that they have the attitude of they're coming to learn, because I can work with anyone and we can get you where you need to go for sure. For sure. If you have that attitude and we're willing to put in the work. So do you have that attitude and you're willing to put in the work? Because it's not easy every day.
Yeah.
It can be fun, but not easy.
Yeah. Yeah, especially I know like a lot of people are like EMs, on the come up. Everyone's liking an EM again. And I'm like they come up to me and ask me questions. I'm like, yeah, go for it. Like do your research. Like it is such a welcoming field to anyone that decides to go into it as long as you're willing to put in that work.
Mm-hmm.
So then I guess to wrap things up, what is one message that you want applicants to take away from your program specifically?
I would say, and this is what I say to my residents, what you do really does matter. So what you put into your residency, it may not seem like it every minute, but it really matters. And you won't know when that comes to fruition, but maybe a patient in the future, maybe somebody's life that you affect because you inspire them to become a doctor. What you do matters. And so I think that's a huge, heavy responsibility sometimes, but it also is what keeps us going and drives us towards community connection, service. And that's really important. Not everybody has to be a Mother Teresa, but what we do actually does matter. It's not just nothing. And so I think that's kind of a life lesson, but we're big on that. Like when you go to residency, you're not just learning how to treat a renal stone or GI bleed. You're learning how to life for like the rest of your career. And so I think it's important for you to learn from my mistakes and from the things that old people like me now look back and think, oh, this is really important to know and to hold close. So I think that's what people can take away.
Well, thank you so much for taking the time to speak with me today. I know that it sounds like you're very passionate and your program sounds amazing. You guys have a great community. You guys really put a lot back into your residents, which is something really important that we all will look for in a residency. So thank you again. If there's nothing else that you would like to add, I will stop the recording now.
It's great talking to you, Maria.
Thanks, you too.